Hi, my name is Josh, and today I'm going to be doing a newborn assessment on baby LeBron. Um, After talking to the parents, baby LeBron was born 10 hours ago. He was born vaginally, and right now he is just sleeping. Um, Before getting started, I would make sure to have all my equipment with me, which is my stethoscope, my pen light, and my gloves. I would also have a measuring tape, but I don't have that with me. Um, and then I would make sure to do hand hygiene and provide the baby privacy. Um, and to start off with assessment, I would just do a general observation and I would be looking at the color of the baby. Baby LeBron is an African American, so he's going to be reddish and dusky. His posture is relaxed. Um, he has movement on his extremities that he's able to move freely. Um, his proportion is normal, and normal is his head is 1/4 of his body. Um, his movement is able to move equally and bilaterally, and then his skin is normal. I would now be looking at baby LeBron's measurements, and for this, I'm going to be putting my gloves on. So baby LeBron is 3,600 grams. The normal range is 25 to 4,000, so he's within the normal range. His length from his foot to his head is 50 centimeters. His head circumference I would measure, and then I would start at the back of his head and then go up to his eyebrow. His head circumference is 34 centimeters, and then his chest circumference I would start from the back of his body and then go up to his nipple line, and then that measurement is 32.5 centimeters. Now I'll be looking at baby LeBron's respiratory, and to start off, I'm going to be counting his respirations by observing the rise and fall of his chest, and I would do that starting now. So after observing for 1 full minute, baby LeBron's respirations were at 50, which is within the normal range of 30 to 60. He had no signs of respiratory distress, and but if he were to have signs of it, the 6 signs would be tachypnea. He would have flaring around his nares, and he would have cyanosis around his mouth. I would also be aware of or look for grunting, any grunting noises that he would make, and to see if the rise and fall of his breathing is symmetrical, or if it or if he has a seesaw or paradoxical respiration. Now I'm going to auscultate baby LeBron, and normally you would want to use a pediatric stethoscope for newborns, just because they're so tiny and small, and their organs are also going to be tiny and small. So you would want to use that for size and accuracy compared to an adult stethoscope. But in this situation, I would use an adult stethoscope, and I would just use the bell. So now I'm gonna auscultate. And then I would also listen to his sides. So his breathing sounds were normal, and I would also want to mention, like I mentioned before, baby LeBron was born vaginally, but if he were to be born via a C-section, he would be more vulnerable to secretions in the lungs, so you would want to be aware of that. Moving on, I would now be assessing his cardiac, starting off with his heart rate. And with the newborn, you would want to measure their heart rate on the third and fourth intercostal space, which is more lateral compared to an adult, where you would measure it in the mid-clavicular line on the fifth intercostal space. So I would now listen to his heart rate for 1 full minute. So baby LeBron's heart rate was at 148, and that falls within the normal range of 130 and 120 to 160 beats per minute. Next, I'm going to palpate baby LeBron's brachial and femoral pulses, and I'm going to be noting the rate, rhythm, and strength. I'm going to be starting off with his brachial pulse. His brachial pulses are equal and normal and are about +2 bilaterally. And then I would do his femoral. And his femoral is also normal and equal, +2 bilaterally. And I would take his blood pressure, but normally in this situation, you don't really take a blood pressure for a newborn because it is just less reliable and is harder to measure, but you would want to do it just in case if you see any complications that arise, like with his breathing or just his heart or anything, but a normal blood pressure range would be 65 to 95 systolically, and then 30 to 60 diastolically. I'm now going to be looking at baby LeBron's head and just assessing his suture lines and his fontanelles anteriorly and posteriorly. Baby LeBron does not have any or does not have a flat or sunken fontanelle, which may be a sign of dehydration, and he also does not have a sign, or he does not have a bulging fontanelle, which is indicative of just increased intracranial pressure, and that may be due to just excess fluids. And baby LeBron's head is round, so it is not indicative of caput succedaneum, and that happens when a newborn is born with a cone-shaped head, because they were just smushed and they're just smushed in their mom's cervix when being born vaginally, but that is normal and that usually goes away very quickly. And I would make sure to assess for cephalohematoma, and that is whenever bleeding happens in between the parietal skull and scalp, and that one takes longer to decrease or go away. It usually takes from weeks to either months, so you want to be aware of that. Looking at his eyes now, there appear to be no abnormalities. He has brown eyes, and his sclera is white, and there appears to be no yellow in his eyes, which is a good thing because that means there's no jaundice. I'm now going to use my pen light to measure his pupils. And his pupils are equal and reactive to light. Now I'm going to be measuring his ears, and I would look at where the top of his pinna aligns, and they align with the outer edge of his eyes, which is normal. And then I'd also be looking out for any preauricular tags on his ears, and he does not have any, but if he were to have any, that may be a sign of just renal malformation. Moving on to his nose, I would want to check for patency, and I would do that by closing his mouth and then occluding one nostril and seeing if you can feel air moving. And both of his nostrils are patent. So looking at baby LeBron's mouth now, I would want to assess if he has a rooting reflex, and to do that I would just take my finger and run it across, or place it in the corner of his mouth, and he starts sucking, so that means he does have a reflex present, and that is indicative of him being hungry. His mouth is symmetrical, and he has no drooping, so that means that there's no injury to any facial nerves. There are white areas around his mouth, which means that he has Epstein's pearls, but that is a normal finding for newborns, and it will go away soon. And then he does not have any circumoral cyanosis, which is a good thing, which means that he's getting adequate perfusion. But if he were to have it and it increases with crying, you would want to be aware of that, because it is indicative of just congenital heart defects. Looking at his neck and thorax area, he It is short with thick skin folds, which is normal, and he is able to move his head from side to side easily. And there is no webbing or any abnormal fat pads that are visible. Looking at his chest and clavicle, I would first want to inspect for any fractures that the newborn might have due to trauma from birth, and I would do that by just running my fingers on each clavicle. There are no palpable lumps, so that means that there are no fractures, and then I would want to look at his chest shape, which is cylindrical, and then look at his nipples, which he has 2 of, which is normal, and they are both symmetrical. I'm now going to be looking at his abdomen, specifically his bowel sounds, and just by looking at baby LeBron, there are no abnormalities. And once again, I'm going to be using the bell of my stethoscope to listen to his bowel sounds, starting at the right lower quadrant. I was able to hear bowel sounds from baby LeBron. His bowels are active, and now I would just palpate his bowels, and they are soft and symmetrical and round. And I would take a look at his umbilical area, at his umbilical cord, and it's hard to see, but he does have 2 arteries and 1 vein attached to it, and it is a bluish and white color, and you would expect to see that darken over time and eventually fall off. And there were no bulges in his felt in his umbilical area, which could indicate a hernia around the area. So that's a good thing. For baby LeBron, since he's 10 hours old, you are able to hear bowel sounds, but if he were to be born, if you were to take a listen to his bowel sounds immediately after being born, you may not hear anything, and that would be completely normal. I'm now going to be assessing his extremities, and to start off, I'm going to be looking to see if his Moro and Palmer reflexes are present. And to do that, I'm going to take both of my fingers and place it on his palms. Baby LeBron does squeeze, so that is a positive Palmer reflex. And then I'm going to take his arms and bring them up, and then bring them down, and then he does startle whenever I do that, so he also has a positive Moro reflex. And looking at the palms of his hands, he has multiple creases, which is normal, and he does not have any simian creases, which is abnormal and could be indicative of Down syndrome, and that is when you only have 1 crease across the palm of your hands. Now I'm going to be moving on to his hips, and then I'm just going to bring them up and then move both of them around to see if there's any clicking noises or dislodgement, and there are none. Now I'm going to turn baby LeBron, and I'm going to be testing his his plantar and Babinski reflex, and then whenever I grab his feet, his feet squeezes my fingers, and then I'm going to take my finger and run it across laterally on his feet, and his big toe does flex forward and his feet move up, so that is positive of a Babinski reflex. And just looking at his feet, he has five toes on each side, and his hands 5 fingers on each hand. He does not have any extra webbing or anything like that. Finally, I would take a look at baby LeBron's back, and to do so, I would carefully place him like this, and just by looking at his back, it is straight and flat. There are no tufts of hair along his spinal cord, and if he were to have tufts of hair on there, it would be indicative of spina bifida. Looking at his sacrum, there are no dumplings, which would have been indicative of polyandial cysts, and there are no closures or anything on his anus. His buttocks is symmetrical on both sides. There are no Mongolian spots present, and both of his legs are equal. After assessing his back, I would also take a look at his genitals, and baby LeBron scrotum are bilateral, and his testes are intact, and he has no abnormalities that go with it, like epispadias or hypospadias. And after doing my assessment, I would make sure that baby LeBron has his diapers on and is wrapped up in a blanket and returned to his mom, and then I would make sure to perform hand hygiene and have the call bell in reach for baby LeBron's mom.